My name is Kelsey Anderson, and this is my presentation on disparities in rural health. So what are rural health disparities? Many people in rural South Dakota or on reservations must drive long distances to receive health care. They also experience lack of access to healthcare facilities, healthcare resources, and healthcare research. The effects of disparities in rural health can be observed by health indicators such as mortality rates, morbidity rates, maternal health rates, and infant and child health rates. Some people affected by rural health disparities includes farmers, ranchers, and reservations. Here's a personal photo of the New Underwood Fire Department tending to a fire in rural New Underwood. This is one of the few emergency services offered to New Underwood residents living in rural areas. Here are some more personal pictures depicting ranchers in rural South Dakota. Ranchers in South Dakota and other states must face dangerous conditions year-round, from calving and branding in the spring to harsh weather conditions in the fall and winter. Many times, ranchers must endure these dangerous conditions knowing they are often at least 45 minutes away from the nearest medical facility. Lack of state funding to plow rural roads make driving impossible many days in the winter after snowstorms. Now for some state statistics. Meade County has invested $18 million on New Underwood Road without state funding. This road still requires more maintenance, which cannot be done without state funding. 27% of American Indian mothers on reservations reported not having access to transportation needed to attend prenatal appointments. American Indian women, who make up only 8% of the female population in South Dakota, experienced 36.9% of pregnancy-related deaths. 15% of South Dakotans are in poor or fair health, compared to the national average of 17%. Infant mortality deaths in South Dakota are 7.7 per 1,000 births, compared to the national average of 5.8 per 1,000 births. Now for some national statistics. 62% of rural counties in the United States do not have a diabetes self-management education system. Residents in rural areas face greater occupational exposure to vapor gas, dust, and fumes. 15% of the U.S. population is not served by an improved public water system. Less than 8% of physicians and surgeons choose to practice in rural health settings. Rural areas rank poorly on 21 of 23 selected health indicators, including health behaviors, mortality, morbidity, maternal health, child health, and more. Rural Americans' average life expectancy is 2 years shorter than Americans who live in urban areas. Now let's discuss how COVID-19 affected rural areas. Rural populations are more likely to experience pre-existing health conditions such as obesity, diabetes, and hypertension. This increases the likelihood to experience complications from COVID-19. 33% of rural Americans lack access to high-speed broadband internet, making telehealth difficult, which became very popular during the COVID-19 pandemic. Economic comparisons. Rural households have lower median household incomes compared to urban residents. Physicians in rural healthcare facilities earn less than those in urban facilities, and farmers in rural areas face economic stressors such as falling commodity prices, natural disasters harming crops, increasing farm debt, labor shortages, and trade disputes. So, what is currently being done? Meade County is applying for state funding to make commutes safer and easier. The South Dakota Advisory Committee is trying to get better training for caseworkers in the South Dakota Department of Social Services, working with American Indian mothers. They are also advocating for coordination with American Indians on reservations to establish better housing, food access, health care, transportation, education, and job opportunities. If you want to help rural health disparities, you can donate to organizations that help reservations, volunteer at a reservation or reservation hospital such as IHS, or support local farms by buying from local shops instead of chain stores. To finish up my presentation, here are my references for the facts I used, and here are the photo references. Thank you for watching.